And we turn now to Men's Health Awareness Month. And this morning, two Valley doctors are walking in the shoes of their cancer patients. And this story comes with a powerful reminder about perspective. Were you a little nervous?
I was, you know.
I saw it. Women wait to get screened for breast cancer almost every day here at Southwest Medical Imaging in Peoria. But on this day, two men are doing something few in their position ever have.
Right this way. Hold still.
These doctors are getting mammograms.
One of my philosophies as a cancer physician is to put myself in my patient's shoes. You know, I want to think about what they're going through.
Was this revenge for your wife?
It was definitely like a little poetic for her. Yeah, she was like, "Can I come watch, please?"
Dr. Christopher Biggs and Dr. Jason Samuelian are oncologists with the AZ Center for Cancer Care. Their mission today? Finding better ways to communicate with the patients they treat.
I'm going to admit I might have been a little tipsy when I came up with the idea. And
I love the transparency.
I've been ordering these for years, like literally 25 years. And to have to like all of a sudden you're in that gown and like you're walking up to that machine.
And together they have worked with hundreds of breast cancer patients.
I was nervous, but coming in, they stepped me through, positioned me. I was a little tall for the machine. They were able to adapt for that, and it was a little less painful than I thought, so I can't complain.
Both say early detection is key, and facing the fear of this exam saves lives.
If you just look at what has happened to breast cancer over the past 40 years, since mammography has come into the mainstream, death from breast cancer has gone down by 40%, a percent a year. It's an amazing story.
According to the CDC, about 1 in every 100 diagnosed breast cancer cases happens among men. Can you run through what the symptoms are for men?
Yeah, usually it is a painless mass, and so that's kind of one of the things. You get a lump and it doesn't hurt. And so a lot of patients say, well, it doesn't hurt, I'm not going to worry about it. But if it's painless and it's enlarging, that is your biggest worry.
For these doctors, though, getting a mammogram isn't about proving a point. It's about practicing what they preach and finding ways to empathize with patients who are searching for hope and healing.
We are all done.
All right.
I try and remind my patients, because some of their physicians maybe don't think, you know, what they're going through, and I just tell them, remind your doctor it's not your body. And I try and live by that too.
Hold just like that, don't move.
You know how much better you're going to make your patients feel when you say, you know, I've been through this.
I've got bragging rights now. Yeah, I can say I've been there. I don't know if it's going to help or not.
I think it will.
But we'll try.
I'd love to hear from his wife this morning, right? Just to see what she has to say. But leading by example, hoping that more men and women will get screened for breast cancer.
And you bring up an important point, right? Because men can get breast cancer, and it's often not talked about. So thank you for starting that dialogue.
It's important, and that's really what they wanted people to know as well. So for more information and resources, just visit our dedicated webpage. That's Check Up AZ. You can find support, screenings, treatment options, and so much more, including patient stories. Go to abc15.com/checkup.